Good afternoon, everyone. This is Saro Arakinis, your clinical pharmacist. So, this video, I'm going to go over pregnancy preventing methods, especially with intrauterine devices. And there are 3 of them in the market that I'm going to summarize in this video. So, let's get into the intrauterine devices that can be used for prevention of pregnancy or as contraceptives, as we know. So moving to the first one, there is Mirena, which is levonorgestrel-releasing intrauterine system. Prevents pregnancy for up to 8 years. It releases the rate of levonorgestrel in about 21 microgram per day after 24 days. This rate is reduced to about 11 microgram per day after 5 years and 7 microgram per day after 8 years. It's to be inserted by a trained healthcare provider using strict aseptic techniques, so you don't get any chance of infections. Follow insertion instructions exactly as described, and this is for the healthcare professional inserting this device. Patients should be re-examined and evaluated 4 to 6 weeks after the insertion, then yearly or more often if clinically indicated. One sterile intrauterine system consists of a T-shaped polyethylene frame with a steroid reservoir containing 52 milligram of levonorgestrel packaged with a sterile inserter. So this is Mirena, which prevents pregnancy for up to 8 years. Then we move to the next sister drug, which is Kyleena. It's a levonorgestrel-releasing intrauterine system that prevents pregnancy for up to 5 years. It's a progestin-containing intrauterine system, just like Mirena. Release rate of levonorgestrel is 17.5 microgram per day after 24 days and declines to 7.4 microgram per day after 5 years. Kyleena must be removed or replaced after 5 years. It's to be inserted again by a healthcare professional that is trained to use aseptic techniques. Patients should be re-examined and evaluated 4 to 6 weeks later after insertion to make sure everything is okay, and then yearly afterwards. So this is Kyleena. So we talked about Mirena and Kyleena, and then the sister other drug is LILETTA, which is levonorgestrel-releasing intrauterine system. This progestin-containing intrauterine system prevents pregnancy for up to 6 years. The initial release rate of levonorgestrel is approximately 20 microgram per day and declines progressively to approximately 8.6 microgram per day after 6 years. It can be removed at any time, but must be removed by the end of the 6th year. Is to be inserted into the uterine cavity by a provider that is trained to do this procedure in an aseptic space. Patients should be re-examined 4 to 6 weeks after the insertion and thereafter on a regular basis, on annual basis. So again, these are the contraceptives, intrauterine devices, Mirena, LILETTA, and Kyleena, which is to prevent pregnancy for a number of years, 8 years, 5 years, and 6 years. For more detailed information on these drugs, refer back to the package inserts, which will give you more information on the dosing, cautions, precautions, and device instructions per each medication. Hope you enjoyed this video. As always, stay safe and take your medications.